So Jody, tell us what is coming up with Rappel Diabetes Learning Center.
Well, we have a ton of diabetes classes and management instructions, and of course we always have our ongoing schedule of events, but we have a couple of special events that are going to be in the next week actually, so we're going to be really busy.
All right. So
our support group, we're going to be hosting Miss Nancy Savela, which is our APN down at the Fairlamb Center. She's going to come and talk with us about the connection between aging and dementia and Alzheimer's and diabetes, what to look for, give us some tips and obviously some good health information about all those different topics. And that is our regular support group that we have once a month on the fourth Tuesday of every month.
Fourth Tuesday, okay.
Yes, and we hold that because the group has gotten so large over in the large dining room, the Lagerborg there at the hospital. So it's not actually at the Rappel Center, but we are affiliated obviously with that group. And we have sometimes anywhere from 20 to 40 to 50 people come.
Wow.
So it is definitely a growing group and a need that we obviously want to continue to support our patients, even after maybe they come to class or that they have gotten their blood sugars under control. We want them to be able to keep it that way. And so just providing that extra support, I think, is one of the neat things that I get to do and kind of help facilitate. And I always tell my patients that come over to the Rappel House, you know, you don't have to listen to me month after month. I get some special guests to come in and talk.
what time do you do that?
That is always at 5 p.m.
5 p.m.
And it usually lasts about an hour, so it's not a real lengthy program. Of course, we have some time for question and answer with our guest speaker. And I think most people really enjoy getting some other information, getting some further information about different topics related to their diabetes.
And Nancy's so knowledgeable.
Man, she's great.
You bet.
She is just great.
That would be one I'm going to try and come to as well, because even if you don't have diabetes, what you take away for others in your family, your loved ones, the friends that it may be impacted by diabetes, to get that knowledge, get that learning behind you. So that's great.
That's one of the great things and why we started doing the diabetes support groups, not just for the patient. And that's something that I get asked a lot. Well, what can I do for my dad? Or what can I do for my loved one that's coming to visit or coming to stay the summer or whatever?
Sure.
And so we see that a lot, that there is a lot of family that wants to support their family member or their loved one with their diabetes diagnosis. It is not a one-person disease. It really does require the whole family to be on board.
I was going to say, especially if you do the cooking.
Yes,
because nutrition is so crucial to so many chronic diseases.
Sure.
You know, we really need, we are what we eat, I think. So.
Yes, and we utilize, you know, I'm very fortunate, and I know I always argue with my friend Regina Ellis, who's the coordinator at the Pites House, on which one of us has the better job.
Yeah.
But I'm very fortunate about being able to work with and collaborate with Miss Jan, our dietitian. You know, we work side by side every day dealing with and looking at, you know, with our chronic disease, diabetes, but then also I see her helping other patients with other, like you mentioned, other disease processes. The cancer support group, I know she speaks with them. We have a class for our renal patients that are going through kidney problems and kidney disease. So there's just all kinds of different avenues where nutrition really does impact what we eat impacts our overall health every single day of our life. And we don't realize that unless something bad happens.
Or we get ourselves educated.
And that's part of the reason, as I always say, that's what gets me up and gets me to work every morning. It's making sure that we're getting information out there to the people that need it and that can utilize it.
And one way that you do that, correct me if I'm wrong on this, Jody, but my understanding is that, for instance, if a patient in the hospital has diabetes and the nurses check to see if they would like to talk with you, you'll go over and spend time in the hospital with families and person with diabetes. And
myself and Jan both, with us having the certification with diabetes education, it pulls us in a lot of times to help at the hospital. And we do, just like you said, they give us a call, we go over and start that relationship right there, even when something critical has happened that sent them to the hospital. we feel like it's important to make that connection as soon as possible. And so just sometimes just going over and introducing yourself and saying, hey, I'd like to help you. I'd like to get you into some of our classes so that we can give you some more information.
Right.
It makes all the difference in the world. And I know that for me, the hospital's never been a scary place, but for a lot of people it is. And so anything and anytime we can help with that, we try very hard to get over and provide that support. Even though we are technically an outpatient facility there at the hospital, it sometimes starts right there inside the hospital.
It's sort of the hospital gets you all stabilized. Now here's your safety net
Right.
and a way to recovery.
Sure.
So
Sure. And hopefully, staying out of the hospital for a little while. I know that's a critical thing right now with all the changes we're seeing in healthcare and insurances and everything else. It is just a vital piece to educate our patients, to help them to the best of their ability, to be able to care for themselves and stay healthy.
And that's across the board. Healthcare is shifting to really putting much of the responsibility for your own health back to where it belongs, and that's the individual person.
Sure.
Yeah.
Outside of the hospital, being healthy and staying healthy, keeping up with our individual health. And it's a huge part of what I teach about, I know in our class, is being your own advocate. And this nurse specifically, I know I advocate a lot for a lot of different patients for a lot of different reasons. But anytime I said, just because you come to the diabetes center one time for a class doesn't mean you can't call me in a year from now and say, hey, I need your help. That's the growing resource that we've become, I think, in all the community houses.
Yeah, the lasting relationships.
It is an
Exactly.
ongoing support then
Yes.
from then on. And I know I've been at the Rappel now for almost 5 years, and I literally have some patients that I remember meeting within the first couple of weeks that I was over there. I still see them on a regular basis. And to me, that's what it's about, helping.
Well, and it makes sense because there's always new there's new gadgets coming out. There's the technology changes in the blink of an eye, and
the research and I say this often as well. The squeakiest wheel gets the most attention. Diabetes has become a huge overall factor in our health. 27 million Americans with diabetes.
Wow,
it's unbelievable. And then a portion of those people don't even know because the signs and symptoms are not really, really, really going to make you notice or sit up or have a pain or send you to the ER. It's very sneaky. And so we try to get out and educate folks too. And another service that we offer is what to look for or what to maybe question about when you are going to the doctor. If you've had that family history or someone in your immediate family has had diabetes, you need to be asking your doctors and your physicians, do I need to be tested for this? These are some of the symptoms to look for. I've been really thirsty, or I noticed I've been going to the bathroom, or I've been real tired and just run down lately. And a lot of those symptoms we can blame off on other things. Right. So I educate folks about that a lot as well when we're out doing presentations and different things, is to make sure that you're being that advocate for yourself.
Absolutely.
You're driving that bus for yourself, basically.
Absolutely. Well, what else have you got? Special events coming up?
One more special event that I do have that I want to make mention of, even though it's sort of a specific special event for a specific group of folks, is our Hackler Healthy Kids 5K.
Yay, got my
I know you've
sneakers
got your
on.
sneakers on today. And that's going to be coming up Saturday, May the 30th, over at the Hackler Intermediate School, which is kind of back behind the hospital there. But our Hackler kids for the last 4 years now have participated, and we started at that level because if the current trends continue, the CDC says 1 in 3 kids born after the year 2000 will have diabetes. Well, that hits home huge to me because I have 4 kids at home.
Because of obesity,
because
primarily?
Because of the huge mass conglomerate of different things. Obesity contributes to that. The way we eat, the technology that we use now, which takes away from our physical activity and what we're doing.
Exercise,
less movement, more brain power, but less physical movement. Just a huge huge combination of a lot of different things.
That's scary numbers. Those are scary numbers.
And hopefully we will see, you know, from 2010 to now, we've seen sort of a plateau. And so we hope to see that continue to maybe plateau and even start to decrease. But right now, if we fast forwarded, that would be what would be looking at, you know, as far as our overall total population. Billions and billions of dollars, healthcare dollars, lots of time lost from work for health reasons. You know, there's just all kinds of different statistics out there that you can look up. But when we started this 4 years ago, those kids in that intermediate school, you know, the 3rd, 4th, and 5th graders, they're falling into that category. These are the kids that are falling into that born after the year 2000 category. And so the teachers at the high school collaborated with myself and Sherry Smith, our other diabetes nurse, and we took it to Hackler. The kids wanted to do something, the high school kids wanted to do something with their academy and sort of promote. And so the CAB Academy, which I was a little bit confused about why they chose to do this, but it's the Communication and Businesses Academy, wanted to get involved and do something a little outside of their comfort zone.
Right.
And so they started educating the kids, and it's just evolved. In the last 4 years, we've done different things with the kids from the high school, going over and educating the kids at the elementary schools. So it's been a huge partnership between all of those teachers and kids in schools, and then for us and Wells Fargo. And so we've come across and done a lot of different educational pieces, but this year is exciting because one of our very own students, or one of my very own students at the Diabetes Center is actually one of our type 1 patients, and Miss Mia Williams is over educating all of her classmates and teaching them about living healthy, eating healthy, being healthy, and then we're going to finish it all up next Saturday with that 5K for the kids and their families.
And their families.
Yes.
That's the key, too.
Yes.
Get everyone involved, everybody, the parents being absolutely the role models.
Yes.
And doing things with their kids. And Miss Mia, absolutely. She was at the health fair this year. She is a delight, and what a good representative she is.
And she is owning it. She's taking responsibility for her diabetes, even though we tell her often it's not your fault necessarily. You know, there is no blame with diabetes, whether it's type 1 or type 2. But what can we do to be more healthy, and what can we do to promote your peers and for them to understand your disease? And so she's just taken that ball, and her mom April and her dad Sean, they just help in anything that they can do to help this child. So she's been a huge inspiration over there, and I know she's been helping a lot. And we're honored that she is taking such a role. So we're excited about it. Saturday, May the 30th at 8 a.m. over at Hackler.
Okay,
we'll get started.
We're going to talk more about it right after we come back from this break. Don't go away. We'll be right back.